Hello everyone, my name is Sanchala Sehgal, and I'm a medical student at the Keck School of Medicine at USC. Today I will be presenting on my research titled Follow-up After Unsatisfactory Cervical Cytology in a County Hospital Setting, and I would like to acknowledge my co-authors, Dr. Barakazai, Dr. Nguyen, and Dr. Gordon for their help with this project. The 2012 updated guidelines for the management of abnormal cervical cancer screening states that repeat cytology should be completed within 2 to 4 months after an unsatisfactory cervical cytology. Previous studies have shown that women of color have a longer time to follow up and a lower rate of follow-up after receiving an abnormal pap smear result. Older women have also been shown to have lower rates of follow-up than younger women after receiving an abnormal cervical cytology. However, most studies do not focus on these differences with respect to unsatisfactory pap smear specifically. Therefore, the objectives for our study were to investigate whether follow-up times for patients at this safety net hospital meet the clinical guidelines for unsatisfactory cervical cytology, and to investigate whether follow-up after an unsatisfactory pap smear is related to differences in patient age, race, or history of medical comorbidities. This was a retrospective observational study. Patient charts were reviewed to collect information on patient demographics, history of malignancy, and history of comorbidities, including hypertension, diabetes, lupus, and history of DVT or pulmonary embolism. Patients who received an unsatisfactory cervical cytology between January 2015 and September of 2019 were included. In order to assess for a relationship between follow-up rate and race, history of malignancy, and history of comorbidities, chi-squared testing was used. Logistic regression was used to assess for association between follow-up rate and patient age. Kaplan-Meier and log rank analysis were used to assess differences in follow-up time by race, history of malignancy, and history of comorbidities. Linear regression was used to assess relationship between patient age and follow-up time. Overall, data was collected for 2,199 patients. Our study population was 78% Hispanic with a median age of 47. The median follow-up time was 88 days, and 76.5% of the patients were followed up. We found that Hispanic women had the highest rate of follow-up at 79.5%, while Black women and women in the other race category had the lowest rates of follow-up at 61.5% and 61% respectively. Additionally, we found a statistically significant difference in follow-up time by history of comorbidity. Patients with no medical comorbidities had a median follow-up time of 78 days, while patients with a history of comorbidities had a median follow-up time of 95 days. In conclusion, we found that the median follow-up time at this county hospital did meet the ASCCP clinical guidelines for follow-up after an unsatisfactory pap smear. We also found that patients without a history of medical comorbidities had a decreased time to follow-up compared to patients who did have a history of medical comorbidities. And Black women had a significantly lower follow-up rate after unsatisfactory pap smear than Hispanic, white, or Asian women. These findings can be used to identify patient populations that may be more vulnerable to inadequate follow-up or loss to follow-up after an unsatisfactory pap smear. Thank you for listening.